6 unique and unusual people living with very rare conditions. Number 6. Stephanie. Stephanie is an extraordinary girl living with a rare condition called Duchenne muscular dystrophy, which is usually found to affect males. Diagnosed with the condition at just 3 years old, doctors did not expect her to live beyond the age of 7. Over time, Stephanie's muscles weakened, leading to severe scoliosis in her spine, which bent into an S shape and placed significant pressure on her right lung. To address this, doctors implemented a unique solution, a device known as a halo. It involved attaching 15 screws to her skull and connecting them to a circular metal band around her head to stretch her spine and slow the progression of scoliosis. However, with the support of her family, Stephanie continues to inspire other young people with disabilities as a content creator, reminding them that if they are having a bad day, it's just a bad day, not a bad life. Number 5. The alien baby. A mother from Rwanda, Bajaneja Liberata, gave birth to a newborn with a rare and unique condition where the baby's skull is triangular in shape, giving him an unusual appearance. After the birth of such an unusual child, Bajaneja's husband and family abandoned her. Her husband denied any responsibility for the child, referring to the baby as an alien's child. Unfortunately, due to this condition, the baby experiences a great deal of pain and cries frequently. Strangely, doctors have been unable to determine the cause of the condition, leaving Bajaneja to struggle on her own to care for herself and her son without any support from the hospital or her family. Number 4. Xiaohui Kang. Xiaohui Kang, known as Mask Boy, is a young boy from Hunan Province, China, who suffers from a severe craniofacial cleft. Born in 2009, he has a rare congenital condition called transverse facial clefts, which causes large gaps extending from both sides of his mouth toward his ears, giving him a distinctive bilateral facial appearance. The villagers often criticized Hui Kang's family for his unique features, even suggesting they abandon him. Despite these challenges, Hui Kang's family has continued to care for and support him with love. Number 3. Runa Beum. Runa Beum, a girl from Tripura, India, was born with hydrocephalus, a rare condition that caused cerebrospinal fluid to accumulate in her brain. This accumulation led to her head swelling to nearly 3 times its normal size, measuring 37 inches in circumference. The pressure on her brain made it impossible for her to sit upright or crawl. After undergoing 5 surgeries to drain the excess fluid, the circumference of her head reduced to 22.8 inches, allowing her to lead a relatively normal life. Tragically, Runa passed away in 2017 at the age of 5, just before her final surgery. Number 2. Moin Junetti. Moin Junetti is a young Indian swimmer born with osteogenesis imperfecta syndrome, commonly known as fragile bone disease. This condition has resulted in short stature, multiple fractures, a curved spine, and blue sclera. Additionally, he requires metal rods to support his fragile bones and uses a wheelchair for mobility. Moin pursued a career in swimming despite his physical limitations due to illness. He earned more than 22 medals from national and international Paralympic swimming competitions, thanks to his mother's consistent support, hard work, and dedication. Number 1. Deborah. Deborah was born with severely shortened or absent arms due to a rare condition called phocomelia syndrome. As a result of this condition, she had only 1 finger on each of her hands. Due to the small size of her arms, there were limitations in performing daily tasks, so she learned to use her feet as hands, which allowed her to independently complete many everyday tasks, such as straightening her hair and doing makeup. Despite the challenges of her journey, Deborah developed the skill to adapt in her own way and work with her feet, discovering a sense of independence.